V27.
We'll be taking your phone calls from around the world and right here in the U.S. Welcome, everybody. We are live with Dr. Carolyn Dean here on AchieveRadio.com. Another fabulous Monday evening. I think it's the 17th of October, 2016. Good Lord, how the time flies. I think we've been doing this show for about 5 years, and it just never ceases to amaze me how rich the content is, how inspiring, how informative, and how diverse the callers are, and everybody chasing the same thing: health, vitality, and well-being, clarity, peace of mind, and a drug-free, surgery-free solution to health, vitality, and well-being as well. And it's so perfect that you've landed here this evening, and we welcome you all because you're going to have a chance to talk to the one, the only, the inimitable Dr. Carolyn Dean, who for 40 years has stuck to her guns, buddies. And I'll tell you what, she has stuck to her guns. She doesn't care what you throw about her to her, what you say about her. She doesn't care. She knows she's right, and she's sticking with it. That's her story, and she's sticking with it. She knows sugar's bad for you. She doesn't care what anybody says. She knows it's good for you to have magnesium and minerals in your body 24/7 coursing through your veins. She knows it's great for you to have a very small, simple routine of taking care of yourself with some vital nutrients and products that are going to serve you well. And she knows what it means to do all these things because she does them herself every day, and she looks fantastic. She feels fantastic. And she has to do that to keep up with her very fantastic partner, who is also equally good-looking and very fantastic. We're so happy to have her with us this evening. And before I bring her on, I just want to remind everybody again that Dr. Dean has not only been in the forefront of health issues for 40 years, but at that whole time she's been a doctor, she's been a naturopath, she's been on the leading edge of creation, she's been an acupuncturist, a nutritionist, an intuitive lecturer, a consultant and author, an expert in the world of summits. My gosh, she's done so many summits, and so many people have been blessed by her participation there, and, of course, a purveyor of common sense. We're so happy to have her with us this evening. Welcome again, Dr. Carolyn Dean.
Thank you, Ginny. Fantastic. Yes. I don't know where to start after your introduction. You are a hard act to follow, I must say that.
Impossible. Very good.
Yeah.
Well, it's all true, and it's so exciting. And I don't know, we get calls, we get emails all the time, Carolyn, from, so many people asking, what about this? What about that? What about this? Asking us about other products. And I do wonder sometime about other companies' customer service and what is their experience, because our experience is just an amazing, joyful ride every single day of knowing that these boxes that we're shipping out all over the world are going to be such a blessing to people, and knowing that the people that do call and ask for help and support are hearing information that's coming from a doctor. I mean, you can't say that about other supplement companies, even other supplement companies that are named like Doctor's Best or whatever, just to drop a name. I mean, that's not a doctor. You know what I mean?
Right. And I guess that's why we really promote our customer service, the radio show. I'm writing all these booklets so people can educate themselves. I know it's frustrating for some people. There was a Facebook comment recently where someone was saying, I just can't make my way through all this information. Just tell me what to do. And that's what we're trying to tell people to do. And I say it over and over again. And I know someone else emailed today, and really wanted to have a consult with me, but I don't have the time to do that, and it ends up being very basic and common sense and simple. As you said, Ginny, I tell people to take your minerals, take the complement formulas. If there are other symptoms, do a yeast detox. So it's minerals and yeast detox. And then when you do that, when you're focused on taking care of yourself in those ways, and if there are still problems, then get in touch with us. Most people with their half a dozen drugs and their symptoms have gotten that way because they've just blindly listened to doctors and taken their prescriptions, and then they're really annoyed. And it's not us that you have to be annoyed with. Maybe it's not even these other doctors, but be annoyed with yourself enough that you will start to really look at everything you do and take responsibility. And like Ginny says, what we've got going for us is 99.9% of the people who take our products do it on their own, do it according to instructions, and they do really well. And we're basically here for the 0.1% who do have so much toxicity, are on so many medications, are so sensitive, are so worried, anxious about their health or what they're taking, that they really need that hand-holding. And I noticed in today's blog, Ginny did an anxiety blog, and that's really important to look at. I have just finished a booklet on anxiety, and I say at the outset, I really didn't really want to write an anxiety blog because I don't want people to think that we're treating a, quote, psychiatric illness. But what I'm doing with this anxiety and magnesium information is trying to sort out the people who have magnesium deficient anxiety. If your anxiety is caused by magnesium deficiency, then the REMAG is going to help you. And the booklet explains why and how. And it'll be interesting to see when we launch that booklet, the kind of feedback we get. But we, started sort of surfing the waters on this with Ginny's blog. And basically, she's talking about the panic attacks and anxiety, the intense moments of extreme chemical imbalance in the body and mind, causing symptoms of palpitations, dizziness, abdominal distress, shortness of breath, emotional symptoms, panic, fear of dying, and dread. And in the booklet, I'm sure I mentioned that when I first started going through my menopause, I had these pre-hot flashes or just surges of impending doom. And seconds after that feeling of impending doom flashed through my brain, I'd get a hot flash. So I knew a few seconds later, oh yeah, that's my warning sign of my hot flash. So what that told me is that a feeling of such intense dread is a chemical imbalance. And a chemical imbalance in the body can often be balanced by magnesium. And certainly we've heard on the show, and I've heard from clients and customers over the many, many years I've been working with magnesium, that maybe they were taking their magnesium for a dozen other different things, but their anxiety was also relieved. And that's where the chapter I wrote in Magnesium Miracle about anxiety, depression, and sleep, I found resources about that in the 2017 edition that's coming out June 2017 of Magnesium Miracle. I added some more references about anxiety and magnesium. So I'm pretty convinced that magnesium is going to help most people with anxiety. And what it will also do is help people who've gotten on the bandwagon of taking sleeping medications, anti-anxiety medications, antidepressants for their anxiety symptoms. It'll help them wean off those medications to try to sort out, for once and for all, whether or not they actually have a psychiatric problem they need to be drugged for, or if in fact they have magnesium deficiency. So it is a huge topic, and when you look at the statistics now of anxiety and stress being so prominent in our society, it is important for people to have something safe, something non-addictive to treat their symptoms of anxiety. When you look at medications for anxiety and for sleep, they all have in the fine print in the insert to be used for short-term only, and short-term is 2 weeks. And unfortunately, we have people coming to us who've been on these types of medications for years, and they're only now realizing that these medications may in fact be causing more and more magnesium drain. So as the years go by, they get sicker and sicker and develop more magnesium deficiency symptoms. So I guess that's sort of our focus today. I know we don't stick directly with our topic because we have a lot of time and we can cover a lot more territory. But I'll ask Ginny if that's enough of an intro to anxiety and magnesium for now.
Well, let me just say this. From a customer service standpoint, one of the most difficult things, Carolyn, is people who are already anxious and very nervous, and then they maybe start using Remag. Maybe they overdo it, and then they get hepped up or revved up, and then they freak out, and they think that they can't, they're not sure how they're supposed to manage everything. So if you could talk just a little bit about, how to build your dose and manage anxiety symptoms, if that's what's occurring for people.
Yes, a very good point. I'll have to see if I've put that in the anxiety booklet. That is very important because it's the fear, anxiety, even paranoia about the body's symptoms shifting when you take a nutrient. And when you take magnesium, things can shift. Magnesium has an effect on 700 to 800 different enzyme systems in the body. It can rev up your energy. It can change your numbness to actually a tingling as the nerves are waking up. And then you go through the tingling with more magnesium, and that goes away. But when a person who's anxious develops a new or a different symptom, then it just makes them more anxious. So, yes, in my Magnesium Deficiency Makes Me Worse blog that I have actually reproduced in most of my books, magnesium is going to make your body feel different. And as Ginny says, it is a matter of going really slowly. I've heard from some customers in Australia that our distributor in Australia tells everybody to start with 5 drops in a liter of water and sip that through the day. She's not taking any chances of having people take too much to begin with of the Remag. So everybody starts with 5 drops. On our label, we say 1/4 of a teaspoon, and that itself, 1/4 of 300 milligrams, that's 75 milligrams. And even that, in very, very anxious people, they find it revs them up too much. And we do have that in our literature as well. If you're sensitive or anxious, if you're on a lot of medications, then just start with a few drops of the Remag in your liter of sea salted or Himalayan salted water, and gradually kind of sneak your body into a more magnesium repleted world. Is that enough said there, Ginny? And I'm going to make a note on my anxiety booklet to make sure I discuss that.
Yes, that's great. Thank you, Carolyn. Excellent. Excellent. We're live with Dr. Carolyn Dean here on AchieveRadio.com, and for those of you who want to talk to Dr. Dean tonight, we start taking questions about halfway through the first hour, about 7:30 our time. The number to call is 602-666-6027. That's 602-666-6027, and when you come into the conference call, your call is automatically put on mute, but then what you want to do is hit *5 on your keypad, and that will raise your hand and let me know you have a question or comment, and I will put you on the line with Dr. Dean when we go to our live call. Carolyn, talk a little bit about the blog that you did last week right after the radio show that was so great. I sent it out to our list, but for our new listeners, Sea Salt Superfood was such a great blog. Let's talk about that for a minute, too.
Yes, we had a number of people, even our own Rami, who's always on our chat line. Thank you, Rami. She asked about a friend of hers who's been told not to use salt because of his high blood pressure. And we've had a number of people, Ginny reminded me in customer service, who get the same information, and then they do, have a little bit of freak out when they come across our water intake guidelines, which recommend that they put sea salt or Himalayan salt in their water. So I didn't really do a huge, in-depth article. Again, it's because we know how much better people feel on the sea salt, and we're going by our kind of clinical experience. And what I say is, as we know, salt has been demonized by allopathic medicine as one of the causes of hypertension and heart disease. I say this may be true to some extent for table salt, which is just sodium chloride, which is totally processed out of sea salt just to remove all the other 72 trace minerals and just leaves sodium chloride, and they call it salt, but it's not. Many of these trace minerals, I'm saying, haven't even been studied in regard to optimum health, yet doctors tarnish sea salt with the same brush as sodium chloride. And I give the story of an 81-year-old customer who talked about a female friend of hers who's in her second year of recovery from a heart attack and congestive heart failure. Her cardiologist is making her follow the low-sodium dietary guidelines of the Mayo Clinic and reducing her fluid intake, resulting in a fear of salt and water. I've had some customers say they've been told they can only drink 4 8-ounce glasses of water a day. And I'm saying for a 100-pound person, you need 50 ounces, not 4/8 to 32 ounces. So if you're 200 pounds, I'm saying you need 100 ounces. So, people do get very concerned. But what fluid reduction does for a person is dehydrate them. It squishes your water out, but mostly it squishes it out of your cells. If you're not taking minerals, then your cells neither have minerals nor water, and the water that you drink, it goes right through you. You're always running to the bathroom, or since you don't have minerals in your cells to pull water into the cells, you can actually have edema on top of this restriction. So you have ankle edema, and then your doctor thinks they have to give you diuretics on top of the salt and water restriction. And then the diuretics take out more water and more minerals. And you can see the common sense in what I'm saying. Going on further, this woman who has a fear of salt and water, she's playing golf a lot, so she'll sweat and get more dehydrated. Yes, and in spite of all that restriction, her ankles are often swollen. She has chronic exhaustion and depression, and she's only 62 years old. She's on disability and is overweight. So I also wrote this blog so that our 81-year-old customer could send this to her. And I just go further into the misconception that sodium chloride and sea salt are the same. Someone wrote me after this article and said they heard Himalayan salt had 84 minerals. I don't know that. And, 72, 84, fine. It just shows that we need a lot of minerals. It's very important to get a lot of minerals in our cells to do their normal functioning. I mentioned a journal case study reporting an elderly woman's serum magnesium levels became depleted due to a diuretic she was taking for hypertension. And see, that's part of the problem where the doctors think they have to squeeze the last drops of water out of you to lower your hypertension, and it will lower your magnesium. And serum magnesium is pretty hard to bring that into the low levels because there's a feedback mechanism where your serum magnesium goes low, and then your body pulls magnesium out of the bones and muscles. So by the time your serum magnesium shows very low enough for a doctor to notice, it means you really don't have hardly any storage of magnesium in your muscles or your bones. And I guess that's the gist of that blog. Was there anything else, Ginny, you want to add?
Nope, that's perfect. Absolutely perfect.
Okay, good. So there we are coming up. Oh, yeah, and a blog email after the salt is a superfood. This person says, finally someone comes out in support of sea salt. Other alternative MDs have encouraged its use, but we're all over the board on the amount. Thank you for stepping up and prescribing an amount, and it's a quarter teaspoon per liter. And even if someone is drinking 4 liters of water a day, that's only 1 teaspoon of sea salt, and that's actually within the RDA of sodium chloride, that amount. So it's not excessive in any way. She continues, I do have a concern about the sea salt not having iodine. As we know, table salt, when they start to notice the iodine deficiency goiters forming, this is back in the 1920s, I think, they started adding iodine to Morton's salt or to the table salts. She says on Dr. Mercola's site there have been debates among readers about this, some suggesting a brand called Real Salt is better because it has the iodine. I also think that perhaps drinking so much water is causing me to urinate more and thereby losing the minerals. I'd like to add one more benefit of sea salt, that it's good for fatigued adrenals, and which is very true. I do talk about that. The salt is required for the adrenals. So I answered, because of the iodine question, I recommend my Remite minerals with the RDA of iodine included in a highly absorbable form in my Remite. So my water intake, sea salt, and Remag and Remite guidelines do cover everything I think people require when it comes to minerals. So that was a great question because of this whole iodine business. And with iodine, I really do think we just need the RDA, especially when you get it from Remite, because it is fully absorbed. The iodine is stabilized ionic and absorbed 100% at the cellular level, and your body just takes in what it requires. So I think that pretty much covers salt, Jenny, if we want to move on.
Just that Denise had a question, Carolyn, and one question that she asked was about the water with sea salt. I feel like I get nauseated and a bit constipated when drinking water with sea salt the whole day. Is that a common reaction?
I haven't heard that. I know high amounts of sea salt are used by people for purges, and that would cause some people to throw up, sea salt for vomiting purge. High amounts of sea salt can be used to help liquefy the bowel movement, so constipation does not make sense at all. So I would wonder how much sea salt Denise is taking, and if there were these, types of reactions with sea salt. Really just start with a pinch of sea salt and then work up and see where her body, kind of feels better with it, and if she does the experiment and finds out where her body feels like it's too much. You have to do the experiment. Everybody's different. When we give out these, general guidelines, that's all they can be, and different people, according to their level of their own toxicity, their drug intake, their magnesium stores, lack of them, or whether they have enough magnesium stores. Everybody's going to be different on so many parameters that we really have to ask people to help themselves and be their own doctor. Did Denise get back to you about how much she's taking?
I'm looking right here to see what she says. She hasn't responded yet, so we'll see if she does, and we'll get back to it later in the show.
Okay.
Yeah, we'll see what she pops in with. Also, Laura asked, does the water we drink have to be plain, or can it be with tea or coffee? So can you put Remag in tea or coffee?
The thing about magnesium is that I don't know if the word evaporation is the right word, but I know when magnesium foods are cooked and boiled that you lose magnesium. So I don't know if it, as I said, if it vaporizes or what happens to it. So I do not recommend Remag with tea or coffee. As for your total fluid intake, I tend to say that it's water, it's plain water that the guidelines represent, and other fluids on top of that are not part of the half your body weight in pounds. Drink that in ounces of water. You have to realize how many trillions of cells you're trying to feed with good plain water. And when you have soups or tea or coffee, they do other things. The teas and coffees with the caffeine, they act as a diuretic. So it's almost like the water you drink with your tea and coffee, you just lose that. It just either it's used to flush out the chemicals in the tea or coffee. I don't know exactly what. But the fluid I'm talking about in the water guidelines is plain water. Okay?
Okay, very good. Excellent, excellent. All righty. Well, Carolyn, let's take a couple phone calls. We've got some people that have been holding on. How does that sound?
Okay, I'm pumped and ready. Go. Let's
okay,
go.
Very good. All right, excellent. Again, if you have a question or comment for Dr. Dean, 602-666-6027 is the number. And then when you get on the line, you have to hit *5 on your keypad, which will raise your hand. And we take all calls in the order that they came in. So we're going to go first to area code 856 out in the great state of New Jersey. You're on the line with Dr. Carolyn Dean. If you could state your name and then your question or comment.
Hi, my name is Andy.
Hey, Andy.
Hi, Dr. Dean. Thank you for taking my call. I have a pretty complicated question. I ordered the Remag the other day. Your customer service is wonderful.
Thank you.
But they suggested that I call you. My husband has been getting chemo for colon cancer. It didn't metastasize. He's 81. He's fabulous. He has diarrhea from the chemo and probably from the surgeries that he's had on the colon. Thank God he doesn't get any sick or, no vomiting or anything, but he was just in the hospital. All his electrolytes were way down because of the diarrhea. So he came home, and the oncologist checked his blood work, and the magnesium was like 0.7. So they wanted to put him on supplements, and I said, no, it'll cause diarrhea. Can you give him the IV? They gave him IV, and it caused diarrhea. So I actually never heard of Remag. I Googled, is there a magnesium that won't cause diarrhea? And you came up, and I how thrilled I am. I ordered it after speaking with your customer service, but they had mentioned that the dose that you suggest will probably be too high for him. I got it today, and I don't know how to dose him. My oncologist won't tell me because he doesn't know really anything about the product.
Oh, yes. No, it's perfectly reasonable. I understand what you're asking. Probably the best thing to do, Andy, is actually start by spraying it on his skin so that he doesn't even have to take it orally for him to even have a worry in his head about causing more diarrhea. Now, tell me, does he have any areas that, kind of ache or pain or...
No, he's. I'm telling you, he's 81. He's remarkable other than maybe, pain of aging.
Okay. Well, I was just wondering because sometimes if people have leg cramps, you put it on your leg, whatever. But you can just spray it on his arms, on his abdomen, on his legs. You can.
So if I put some in a spray bottle, I would give like how many sprays, and then we would rub it in.
Yes, you're just going to start with about 4 sprays. But also, do you use a body lotion on him?
Yes, because one of his chemos makes him very, very dry and very peely.
Right. So what you can do is mix, I'd say, a teaspoon of Remag into about 3 teaspoons of body lotion.
Okay.
And it seems to mix. I will mix my Remag sometimes that way. Some people, when they know they're going to use a lot, will actually put it in a blender. When they're going to use about 4 ounces of Remag, they'll mix it with like 8 ounces of body lotion. So it's like
I like what you said about just a couple of sprays and kind of get it inside his, because he's going to need the magnesium, and I can't let them keep giving him the IV. I can't do that.
Right. And then what you do is after about 3 or 4 days of spraying on, 3 or 4 sprays 2 or 3 times a day, then you can start putting a few drops in some water and letting him drink it. Each drop has 2.5 milligrams. And, it seems like a low amount, but it will get into the cells. And if he's drinking it in his water, and I don't know if you've read about how or just heard that we put a little sea salt in the water, too, for the other minerals.
I did get concerned about him with the blood pressure. He does swell in the ankles.
Yeah.
From salt.
And I hope you were able to follow, or you can re-listen to that part of the show in the archives, because the whole problem with edema building up in the ankles is because we don't have enough of the minerals in sea salt, and we don't have enough magnesium. And once he starts drinking more water with, just start with a pinch or 2 of sea salt, get a good sea salt, not the white ones, but, the ones that are pink or gray that have some color in them, because then we know they have the trace minerals. And I know it might be I might be giving you too much information, but basically you'll start with the body lotion. You can also put his feet in an Epsom salt bath, put a cup of Epsom salt in a foot bath, or if he takes a full bath, you can put a couple of cups. That's your magnesium there. And it's just to slowly get his body used to this type of magnesium. And then with the drops, you can use 5 drops in his glass of drinking water with a little bit of sea salt, and he could do 5 drops a day. And then over the next week or two, increase the 5 drops every couple of days until a quarter teaspoon, for example, is 30 drops.
Really?
So, yeah, a quarter teaspoon is 30 drops. And we want to get him up to, 1-2 teaspoons a day to start getting. You see, the magnesium deficiency he's got, that's probably causing some of his blood pressure. And if he feels pretty good right now, he's going to feel fantastic when he gets his magnesium up.
Okay, and they said his calcium was a little low also. But then I heard from somebody, when you're taking magnesium, the calcium will push it out of the cells, so not to take calcium. Or did I hear wrong?
There's a balance between magnesium and calcium, Andy. When your magnesium is in good shape, then it will actually help keep your calcium more balanced. So it is more the problem with women who are taking a lot of calcium supplements that they get into problems with magnesium. But try not to worry about that too much. If he eats some yogurt, or if he's eating fish with bones, if he's getting calcium in his diet, then that should be enough for now.
Well, they wanted me to put him on a supplement, on like Oscal or something like that, 500 milligrams with D2 or D3.
Well,
it is.
Right, yeah, D2 is very synthetic, but the best thing, then after the Remag, then what we'll get you to do is start him on my Remite. That does have some calcium in it.
Great.
And and we're coming out with our own calcium liquid for better absorption. I don't like a lot of calcium because it does cause problems, and most people do get enough in their diet. Does he eat some yogurt or cheese to get his calcium?
He does. Not very often, but he does.
That. Yeah, you can. A nice plain yogurt would be very helpful for his calcium, and also to get his intestinal flora back. And that's the last thing I'll mention to you is this type of diarrhea from colon surgery and chemo is likely because his intestinal flora, the good bacteria in his intestine, are all disrupted. And the best thing to do there is to take a probiotic.
I actually started him on acidophilus a couple weeks ago.
Good.
But it only has, I think 1 billion. But I don't know if 1 billion's enough.
Well, it's not so much the amount, but acidophilus is the weakest one. It's the most common one that people know about, but I can get customer service to send you my recommendation. It's called Prescript Assist, and it's a soil-based probiotic, and he can take 2, even 3 of those a day, and it can actually stop diarrhea that's caused by intestinal imbalance.
Okay, wonderful. We're ready to try anything right now because he's so miserable with it,
Yes, of course. So that's a start. And
I'm going to do exactly what you said. And should I call your customer service to send me about the probiotic?
Yes. You can email Ginny right now at support at rnareset.com, and she'll give you the website and the exact name, so you don't get so you know exactly what to get. I've researched this for many years, and it is really the best probiotic.
Dr. Dean, thank you so much. I so appreciate your taking my call and helping me with this. And
You're welcome.
Too.
Oh, thank you. And, yes, you can keep in touch with me through customer service as you slowly go through this journey. We're here to help, okay?
Thank you so much.
Okay, good. Bye-bye, Andy.
Thank you. Bye-bye.
Bye-bye.
Very good. Excellent. Yes. So let's get a big yay. Oh, I'm just so thrilled when people talk to Carolyn. You have no idea the joy it brings me. Okay, let's see. Let's go to Florida, area code 941. 941, you're on the line with Dr. Carolyn Dean this evening. If you could state your name and then also your question or comment tonight.
Hi, this is Ivana Lazaro from Florida. Good evening, Jesus. I'm so excited I'm talking to you that I can't even speak.
It's okay, Savannah. I'm here. Just call me Carolyn.
Okay, Carolyn, sorry. Yeah, Ivana, I actually been talking to you through the email, actually. I always email Melody, which, by the way, at your customer service, she's been amazing.
Oh, wonderful.
Yeah, she's just amazing. She always has very kind words to say. And she forwarded a couple of emails to you, and actually last week when I first was listening to your show, I almost fell down on my head in the kitchen because you were reading my email, about the 38-year-old mother that that was me. That was me, and I got so excited. I was like, oh, my goodness, she really read my email. It was her, So I just recently went to my doctor, and I persuaded him, which was a very difficult task, to check my magnesium through the red blood count.
Yes.
And it came back 5. I'm taking Remag and Remite for, I think, 7 weeks now. And it was at 5, so it looks like I'm doing a progress. I don't know what it was before I had it done to micronutrient test with SpectraCell, but they don't really tell you like a range. They just say you're deficient. So I wasn't even aware of any numbers. But now it's 5, and now I have to go all the way to 6.5, maybe more, right?
Yes, well, 6 to 6.5, yes. And also depending how you're feeling. How are you feeling, Ivana?
Yeah, it's better than the 3 months ago. I no longer have the attacks, like the panic attack and anxiety attacks. I'm still very, my muscles are very tense, and I get cramps at night in my legs, and I'm very irritable and like shaky. You can really tell that I'm shaking, but it's like the inside shaking and tense and things like that. But I also have just found out that my ferritin levels, the iron, it's 6. The ferritin levels are 6, which they told me in order to feel good, I should be like a 50 or 60. So I was like, oh, this is great. So on top of everything else, now I don't have iron.
Right.
So I.
When was your last pregnancy?
I delivered. It's 8 months ago. I delivered January 29th, and 4 months after she was born, this all happened. I had my first attack, and it was just unbelievable experience. And I went to the doctor, they prescribed. Yeah.
Right. And they prescribed anti-anxiety medications?
They prescribed immediately without even doing anything. They said, oh, this is postpartum anxiety and depression. Here's Zoloft, here's Xanax, which I haven't even touched Xanax. That I will never touch anything like that. But they gave me Zoloft, which was horrible beginnings, but I stayed on it because I didn't know any better. I'm really looking forward to just get off of it. I just don't know how, and I'm a little worried, so I don't do anything with it. But I started, I found you and your website and the magnesium and everything, so I started the Remag and the Remade, which will be now 7 weeks that I'm doing it, and I now do 3 3 teaspoons in my water with the sea salt. So I'm doing all that, but I was wondering if the iron deficiency, like, because I also read that it could cause irritability and restless leg syndrome. And
well, I remember getting the email about that, and I did mention to use angstrom iron from Health Shop 101. Did you get that email?
Yeah, I actually got it. It just came. And I went to the doctor this morning, and he, I guess sometimes you feel like they're just so difficult, And so I told him about the iron, and he said, well, this is very little. This is only like 5 milligrams or 10 milligrams per teaspoon. That will never get you anywhere. And he prescribed me pills that has 324 milligrams, and he said 3 times a day. So
right. No, the problem is they don't understand the 100% absorption of these types of minerals. What happens with the 300 milligrams of iron in the pills they prescribe is it's only a tiny little amount of that is absorbed. The rest can cause really bad constipation because it kind of clogs up the intestines. But let me see. I'll find a stronger liquid iron for you with more milligrams. But, they cannot be the judge of this type of mineral because we just never studied it in medical school.
Right.
So send your I guess it was you're talking with Melody Rose. I'll send Melody Rose where to get a stronger iron liquid. It's along the lines of Remag and Remite, so that you can put it in the water, in your drinking water, like you do the others. And I'll say how much would be good to take. But yes, when your ferritin is low and your iron is low, all those can cause you to be have low energy and a lot of different symptoms, because obviously you need the iron to make good red blood cells, and the red blood cells carry oxygen to your brain and all through your body.
Right.
So you definitely need to improve your iron.
Okay, yes. I was wondering because I was thinking I'm doing better, but I'm still not. I'm far away from what I call being normal.
Correct. It does take time to build up your minerals, but yes, I'm glad they checked your iron. I mean, that's an obvious thing. What gets low in pregnancy is iron and also your thyroid. I don't know if they did your thyroid blood tests. Did they?
Well, I finally convinced the doctor this morning to do the whole comprehensive, because they always only check the TSH, and I've been reading and internet thinking that sometimes they said that they could be normal, but the other like T3, T4 antibodies. So I finally convinced the doctor this morning to run the whole thing. So we'll see to make sure we don't miss anything.
Right, very good. And in the meantime, the Remite has all the 9 minerals for your thyroid, so you are supporting your thyroid. Even if they told you to take a drug, I would probably suggest you wait, another couple of months as your own thyroid wakes up with the minerals. But I'll make an email to Melody Rose right now, and we'll send the iron information to you, okay?
Thank you so much. All
okay.
Right. Thank you. Okay.
You're welcome, and thank you for being brave enough to call into the show, okay?
Thank you. Okay. Bye-bye.
Okay, bye-bye.
Bye.
Excellent. Live with Dr. Carolyn Dean here on Achieve Radio. Cannot encourage people enough to call in and talk to Dr. Dean. We beg people all week long, Carolyn, to call and talk to you. I know it's very beneficial for people to be able to speak to you directly. So, again, 602-666-6027 is the phone number to call. I talked to this gentleman earlier today, Carolyn, Paul in Florida, and he in-clicked you. and said, but, people are anxious about talking on the radio, which, you and I don't understand because we're, give us a microphone. But anyway, he said, I'm so glad that you're doing a show on magnesium and anxiety. I had a reaction to a liquid nano-ionic magnesium. I woke up at 1 a.m. in a panic attack. I may have upped my dose too soon, and now I feel awful and anxious, and I don't know how to reset my body. And so how do I reset my body and start over slowly? I'm not sure what to do. Now, this is not Remag. This is just another magnesium product.
Okay. How to reset? I mean, usually, how to reset? It's hard to say. Yeah, I wish Paul would come on so I could talk to him about it. I don't know how much he took or anything and what it stirred up. Usually it's just Paul, drinking lots of water and, making sure you're drinking sea salted water, taking your B vitamins, taking vitamin C, doing all the adrenal things because it may have just, opened up an adrenal weakness. So I would look at the Remite book about thyroid and adrenal, how to treat them. You know what I'm saying? It might have just opened up his adrenal fatigue symptoms, and now he's stuck with the adrenals being a bit revved up. And going to need magnesium, of course, to fix that. And again, I don't know what magnesium he took. I mean, we tell people to use it spray it on their skin or do Epsom salts baths or slowly build up. But just to understand that you just rev things up too quickly.
Right, very good. Okay, Paul, and if you want to call in, 602-666-6027 is the phone number, and Dr. Dean would be happy to speak to you. We're about 4 minutes to the top of the hour, and I want our callers to hang on. I know we've got some more callers, but I want to get through the top of the hour. So just hang in there for a minute, and then we'll take your calls right after we come back from the break. In the meantime, Carolyn, let me read you a couple of these quick messages that have come in, including Denise, if you remember, who was the gal who had the heavy feeling from sea salted water. She said, I took the amount suggested, 1/4 teaspoon on every quart of water, but after 2 to 3 days I felt the water too heavy, couldn't keep drinking it, tried to have less salt, but still I feel that 1 glass in the morning with salt is okay, but I don't want to drink it the whole day.
Okay, then do that. Do what your body tells you to do. Starting with a 1/4 teaspoon for some people, if you start drinking the 1/4 teaspoon and the quart of water and it immediately feels like it's too salty, it's too much, then certainly cut back and start with a pinch. So just use it as your body wills you to use it, but know that it's very important to get sea salt and make sure you're using sea salt for everything else, for your cooking or baking or salting your food. Make sure it's all sea salt.
Very good. Excellent. Let's see. Sandra says, I seem to have an overactive brain in the night. I get a restless sleep, and I continually dream, particularly of things that happened a year ago. Could this be a sign of magnesium deficiency, and could your Remag help?
Yes, overactive brain, if you're thinking, even worrying about things, it implies that you're not getting a deep enough sleep. It implies you're sleeping lightly, and it's like your brain is still doing daytime thinking while it's supposed to be asleep. And so it's a light sleep, and yes, the magnesium does create a deeper sleep. So, yes,
okay.
take Remag.
Excellent. Melanie typed in and said, Remag and Remite have been a lifesaver for reducing my hot flashes by 80%. I've suffered with them for over 7 years. So she's thrilled. And Jean also typed in and said, gosh, I love to hear callers thank you over and over again to the last caller with so much gratitude. Glory and honor to the last caller. Jean was very excited about the last caller. So thank you again, Ivana, for calling in and sharing all that information. Because when you do call, not only help yourself, but you help everybody, because this is listened to by thousands of people, and everybody gets the benefit of knowing the things that you provoke in Dr. Dean's answer. So thanks again for calling in. We're at the top of the hour, and we'll be right back, everybody.
We'll be back with Hour 2 of Live with Dr. Carolyn Dean, along with host Ginny Gunther, after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com.
Describe the words you know regarding amino acids and our process of ascension. We are trying to get to the marriage supper of the Lamb.
What happens in the blood is you require protein carriers for different things through the blood.
Protein carriers in the blood segue through basically the essence of lysine to change the way that the molecules or the specific gravity, how blood is. If you change its molecular specific gravity, you change how it flows. It's the blood that gives you strength from day to day, and it will never lose its power. The methylation, but it changes the specific, the outcome of the methylation changes the specific gravity of blood. When you start spinning out patients who have been ingesting RNA drops, the specific gravity of their blood will change.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
We return now live with Dr. Carolyn Dean, along with your host, Ginny Gunther, here on AchieveRadio.com.
Describe the words you know regarding amino acids and our process of ascension. We are trying to get to the marriage supper of the Lamb.
What happens in the blood is you require protein carriers.
We return now live with Dr. Carolyn Dean, along with your host, Ginny Gunther, here on AchieveRadio.com. Skype us at ar.call.in. That's ar.call.in.
Okay, everybody, welcome. That was a little interesting, snappy segue thing going on over there, but we're all here, all accounted for, and, of course, Dr. Dean is back, and that's the most important thing because that's who everybody wants to talk to. So let's take a couple more phone calls, Carolyn, from the people who are kind enough to hang in there, and then we will eventually get to our mailbag. So, oh, my gosh, look who's on the phone, one of my most favorite people in the whole wide world, who's been with me forever, Carolyn, since I was an affiliate in 2012, my most favorite, Presley Alford. Hello, Presley.
Hey, good afternoon, guys. How are you?
Hey,
Good.
Presley.
How are you?
Oh, I'm doing very well. I just wanted to call in and actually encourage my neighbor, Tristan, if she's listening, to call in and ask you guys some questions. Her and I were talking the other day about some things that were going on in her life. and I recommended her to your website, and her mom has since ordered the Remag, and I'm not sure what else she ordered, but she was explaining to me some symptoms that she had, and I know for a fact that they were magnesium deficiency symptoms, and so I referred her to you guys, and I just wanted to call in and encourage her to just press *5, so that way she can speak with you guys and get more information about what's going on with her.
Oh, that's great. Well, thanks, Presley. And yes, Kristen, call in. We're happy to talk to you. If you want to wait and call customer service and talk to Ginny or Melody Rose, they're happy to talk to you too. I mean, calling in, like Ginny says, is good because then you get some firsthand information, but also I can ask you questions and help fine-tune. You know, it's not like a revival radio show where you just put your hand on the radio. There's a little more going on here, right, Ginny?
That's exactly right. Very good point, Carolyn. Yeah, just can't put the hand on the radio. And then Presley, that's so sweet of you. I don't even know if you remember, Carolyn, but Presley used to have Remag seminars in his living room for all his aunties and uncles. I think he is one of our most favorite advocates of the product. And so, you know, God bless his heart. But, you know, it's important because you do know when something so simple, and sometimes, I mean, we've talked about that. It offends people's minds that something like magnesium that's so simple can actually help in such profound ways. But if you've had the experience, you know it's true.
Mm-hmm. Yeah, you are exactly right about that. That's all I really wanted to call in and kind of, if she's listening, so that she could hear my voice and actually know that it's okay and everything. And you guys are very friendly and very helpful.
Thank you. And I'll get Ginny to give out the number again, just in case she is listening.
Right. It's 602. Yep. Thank you, Presley. I'm going to put you back on. Thank you, sweetheart.
Sure, thanks.
All right, honey. Hey, Presley, did you get the restructure yet?
I did. I'm actually on my second canister already.
Isn't it awesome?
Man, I love it. It's I actually take it after I do my workouts in the afternoon as for like a meal replacement, and it's so far I love the taste, and I love it. I love it. I can't say much more about it. It's good stuff.
All right, very good, sweetheart. Thank you, Presley. Thank you. Thanks for calling in. And yes, 602-666-6027 is the phone number, 602-666-6027. So, yes, please call in and have a good chat with Dr. Dean. And so the other great thing is she's so intuitive, you know. If something's going on with you, she just knows. I don't know, 40 years of experience. I guess it's intuition and a lot of experience, too. And here we have another good friend of ours, Carolyn, who's calling area code 310. You're on the line with Dr. Carolyn Dean. Hello.
Hello, Jenny. And hello, Dr. Carolyn.
Hello. I recognize that voice.
Oh, it's so good to hear you. Thank you. Now, I know, Dr. Carolyn, that you told me this once before, and I hide behind my advanced age, but that's not the reason. I've always been like this. If I don't write it down, I don't always remember. I find that I fill up the bottle and I'm putting in 2 teaspoons of Remag and 1 teaspoon of Remite. And I feel it's not enough, but I notice I'm not drinking it. And today, listening, I realized maybe I'm not drinking it because I have too much in there. I then, for 2 weeks, I forgot to put the salt in. I put it all over everything I eat. I'm a big salt, and that's, not old-fashioned salt. Mostly I use the pink salt.
Right.
Now, so what I've been doing when I realized I didn't drink enough is I've been taking Calm at night before I go to bed. And then I do sleep. And I think I have done it because I had the most unbelievable cramps the other night. I thought if those cramps with the lower part on my legs, if they were around my chest, I would be running to calling an ambulance, thinking I was having a heart attack.
All right.
So I don't know what I'm doing wrong. And also I want to get going with the RNA drops. And I just must be doing it wrong. You know, when I put the little plunger in to take out the drops, sometimes I barely get a drop, and sometimes I get 3 or 4 drops.
Right.
So I haven't done it right.
Right. Well, let me ask, are you interested
and now I developed some little skin cancer, and I don't believe that. It can't be happening.
Right.
Well, I told you everything.
Well, you can put your RNA drops or Renew on the skin, but sometimes it's just as easy to go and have it, taken off in the early stages. But what about Restructure? Because if you took the Restructure,
I haven't tried it yet because I had so much of a pea protein that I wanted to use it up before I bought any more.
Because what I was going to say is the RNA powder is in the Restructure, so maybe that's a way of you getting your RNA that way when you get around to getting the Restructure. But as for the others, I mean, if didn't you tell us at one point that when you took a whole teaspoon at once of the Remag, you thought it made you have a little loose bowel movement?
No, not me.
No. So then what you can do so that you, if the water doesn't taste good enough for you to want to drink it, sip it through the day, is just have like a half, maybe even a whole teaspoon 3 times a day, and just put it in 4 ounces of water and put in a half a teaspoon of Remite 3 times a day, and drink it down with a little water after
I have to write it down. I have to write it down. This is a 92-year-old brain.
Oh.
It's 1 teaspoon of the Remag and a quarter
and half
teaspoon? Half.
1 teaspoon of Remag and half teaspoon of Remite.
Okay, 3 times a day.
3 times a day. And that will get you your extra minerals you need, and it'll get it into your body because, yes, some people do say that they'll dose up their liters of water and then not finish them up, so they end up not getting enough magnesium because, the leg cramps are definitely a sign of not enough magnesium.
But you told me it had something to do, to take Calm with calcium.
No, I don't really. I don't agree, like the Calm with calcium. But
and that's what I've been taking. I thought that's what you said. Oh dear.
No, well, there are different types of natural Calm. I don't even talk about Calm with calcium. I just talk about natural Calm, thinking that it's just the magnesium. There is some calcium in the Remite. For people who don't get any dairy products. We are going to come out with the Recalcia within the month if people need some extra calcium. But, maybe you're getting a bit too much calcium with the natural Calm with calcium. I don't know. But I know you're not getting enough Remag.
Okay, I'll do that. Now, I went back to drinking milk, of course, only the raw milk. Because it soothed me. It quieted me down, especially if I wake up in the middle of the night and then I drink it, then I fall back to sleep. Well, I stopped it. I've stopped it because I found out, no, I don't have sleep apnea. I have sinus.
And the dairy would give you more mucus.
Yeah, so I stopped this. And I don't know what to do because I wake up in the middle of the night, like last night, and I have of course, candidiasis for years, and I can't do all those things I used to do that are stupid and add to the candidiasis. So I would drink the milk, and now I stop the milk, and I don't know what to do in the middle of the night to fall back to sleep.
Right.
So,
well, if you take the teaspoon of Remag before bedtime, maybe that will put you to sleep. Or, if you want to use just plain natural calm without the calcium, you're going to have to experiment a bit more, I'm afraid, to find out which. But it's a good start is to get enough magnesium and Remite in you.
Okay. Now, the other day when I was fooling around with the RNA, I must have gotten 4 drops. I don't know how much I got. 2 things happened. I woke in the middle of the night with terrible cramps. But I woke from such a deep sleep that I haven't had in 30 years. Wonderful deep sleep. And I couldn't figure out what did it. So I assume after I've been listening this hour that it was the RNA drops because I wasn't doing anything else different.
I see. Now, do you have the regular bottle with the glass dropper? Is that what you're saying is hard to get, or do you have the little sample bottle?
I have 2 of the little sample bottles, and I got a little bottle, an empty bottle.
Yes.
With a dropper. And I've been poking that into the little bottle. Because when I took off that dispenser.
Yes,
because
that's
when I used the dispenser, I couldn't get anything out. And I couldn't measure how much I got out. If it did come, it came in a bunch.
Right.
So I couldn't tell if I was getting a drop or half the bottle.
Right.
So I did this, and I...
Well, what we'll do, I'll get Ginny to send you a regular bottle of RNA drops with the dropper, and maybe we'll just give you that as a gift, fill it up halfway. We'll get the people at the factory just to give you half a bottle of the RNA drops and in a proper bottle with a proper dropper, okay?
And I'll get the restructure.
Yes.
And that will give me some more. Okay.
Yes.
Now, I don't know how to use the Realign. How much? How do you?
It's
how do
one capsule twice a day. 1 capsule twice a day.
Oh, okay. Okay, because I know I need that. What's it called?
Yeah.
Yeah. Okay. Very good. Now, so I was going to say, can I please come to Hawaii? And I'll rent an apartment.
Well, Bob would like to see you here. Bob thinks you're adorable, Ruth.
Well, I have a question. I think it applies to Ruth. Are you still got your boyfriend?
No, he got very sick, and he was so and he did a. They said he took something to die, and he didn't succeed, and he's so embarrassed, and he doesn't want me around because he's falling apart, and I'm not good enough to pick myself up and go to New York and insist. So there goes my boyfriend.
Well, it's one of the greatest jokes. It's my best ad for RNA drops. I say we have a 90-year-old who called and said, Carol, I'm taking your product, and guess what? I have a boyfriend. So that's immortalized here at Dobbstown.
Now you have romanticized that.
Yes, he has.
Actually, if I had been able to convince him, which I wasn't, to get in line with you guys and the product, he wouldn't be in that mess now.
Right.
That's right.
That's right.
That's right, Ruth.
And weird. One of my friends is on your program now, but I have not been able to say to some of my very dear relatives, they won't listen. They think I'm just eccentric, and she's got these big swollen ankles now, and I know what to tell her, but she won't listen, and cut out all the salt. The same old story.
Right, same old story. Again. Yes,
yeah,
you just have to use your energy for taking care of yourself and taking notes and calling in and making sure you're following.
A message from my higher power to tell me take care of myself anyhow. Now, you mentioned to somebody else a yeast detox. How do I
know. I've been trying to get a yeast detox protocol going. It's been difficult. I mean, basically, it's following a yeast-free diet, avoiding sugar, gluten, and dairy, taking the prescriptive probiotic, and that's a good start. What we're saying about the restructure is that it's so readily digested. It doesn't leave undigested food for the yeast to eat, and it'll help your general digestion. So we're hoping that the restructure will help people who have yeast overgrowth. And I don't have a treatment yet beyond what I've been recommending over the years, which is the bentonite clay, psyllium seed, and liquid caprylic acid. But if you're not following a yeast-free diet and taking the probiotics, there's no sense in going on.
I do that.
Oh, good.
But I tried the bentonite clay, and I just got it stuffed up, so obviously I did too much of it. I eat psyllium. And what was the third thing?
It's called Caproyl, C-A-P.
Oh, I tried that.
R-O-Y-L. Yeah.
But I didn't stick with it. Okay, I'll do that again.
Yeah.
I thought what you were saying was follow Dr. Crook. So I went back to trying to follow Dr. Crook. But, I have always had the book, of course. And I didn't do the nystatin. I tried it once, and my reaction, I went into such a cleansing, I quit right away,
I see,
What is it called? What's the word?
Herxheimer reaction.
Right. But at this stage, I'll do anything. I'm very disappointed. I had thought the next 10 years were going to be very wonderful, and all I've been is sick.
Oh.
And
you don't sound sick. I think you're doing pretty well. But like for you, it's not good enough. And yes, you never give up. And with the nystatin, if you can get a doctor to prescribe it, it's best to get the ones that aren't sugar coated, or get a nystatin powder and just take
She gave me the prescription for the powder.
Oh, good. But then just take it very slowly, small amounts, and build up. I've had people in the past, when I used to prescribe it in my practice, just get enough on the tip of a toothpick and start with that.
With or without food?
Without. But anyway, let's get you on your Remag first, and get your sleep sorted out, and then you can think about going on the nystatin powder. Okay, Ruth?
I thank you, ma'am.
Yeah.
As I've told you, I am so grateful. You're so wonderful. It's just awesome.
Oh, that's so sweet. Thank you. Well, we really appreciate you, Ruth. Thank you so much for hanging in there with us.
And give my love to your charming husband.
Oh, yes, he loves you.
Yes, great to talk to you again.
Yeah, thank you, Ruth. Bye-bye.
Bye, honey.
All right, excellent. Live with Dr. Carolyn Dean here on AchieveRadio.com. Thanks, everybody, for tuning in this evening. And we still have a few more callers on the phone, and we've got to get to our mailbag. Carolyn, let's just go to area code 408, the great state of California. And hello, you're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
Hello, this is Linda. Can you hear me?
Yes, Linda. Go ahead.
Hi, Carolyn. I have actually two questions. One is about calcium, and the other one is about the anxiety. So I'll start with the calcium. I've had quite a bit of problem over the last year, I would say, and I have always had sugar problems since I was a kid, and I never knew I had a mineral deficiency. I also had very low blood sugar, low blood pressure as well, and I just stayed away from sugars and exercised, and I managed to get by for a long, long time before I really started having serious issues. And then over the last 5 years, it just got progressively worse, and I didn't really realize what was happening. And I also have always been active in sports. I used to play soccer, and I've been playing hockey. And so what I realized what was happening was that I was losing electrolytes. I was sweating a lot, especially with the hockey, and I wasn't able to replace them. And I literally just exhausted my electrolytes. And this must have been last year around October. I felt so incredibly weak, and to the point where I felt like I couldn't really function normally. And I thought it was always low blood sugar, but it wasn't. It was actually I was low in the minerals. And I didn't really figure this out until this must have been January, February time frame. I started having really bad neuropathy. And it started at nighttime, and then it got even, during the daytime as well. So my hands would go numb, and then my arms would start to go numb. And so I ended up with neuropathy, and then I ended up with joint pain as well, which I'd never had. This was kind of sudden onset, of these things that happened within 3 to 6 months time frame. Yeah. And I had gone to doctors. They had no idea what was wrong, and then I kind of figured it out myself that this was magnesium and potassium, because all the foods that I craved contain magnesium and potassium. So I started loading up on supplements, and I didn't get any, the result that I wanted to see, and I thought, well, maybe I'm just not absorbing them, and I realized that I had digestive issues as well. And so I did start, with REMAG. I'd gone to a natural doctor. I'd gotten tested and also found out that I had a lot of food intolerances because of the digestive upset, also because of the mineral deficiencies. I had a lot of deficiencies, immune deficiencies, the insulin resistance. So I had all these things, and then on top of that, I had a lot of food intolerances. And one of them was dairy, which I removed from my diet. Just a lot of different food intolerances, and some of them were magnesium-rich foods like almonds or black beans. So I was forced to take those out of my diet, and at the same time I said, okay, well, I started with the REMAG and the REMITE and the Realign, and I've been taking those for a good 6 months now. And it helped, and I was only seeing subtle improvement, though. And at the same time, I was also doing nutrient IVs. I was doing like a nutrient IV once a week, and then it went to once every 2 weeks. So I got to the point where it felt like I was getting healthier. But the calcium thing has always been kind of an issue for me, because I felt like, well, maybe I'm becoming calcium deficient because I removed the dairy. I have joint pain, which I never had. I still have this neuropathy, which has seemed to get a little better, and then I wasn't really sure where, what's going on with the neuropathy, whether it's improving or not. It did seem to improve as long as I kept a certain dose of magnesium throughout the day, but I feel like maybe the calcium is just not there. So my question is about how much is the right amount of calcium to get with the magnesium, because I'm getting, and I'm calculating based on how much I'm taking of REMAG a day. I take 4 teaspoons a day and 2 teaspoons at night. Plus, I'm getting also some magnesium-rich foods.
So, sorry, Linda, let me interrupt. Are you taking a total of 6 teaspoons of REMAG?
No, I'm taking a total of 4 a day. And I thought that was the level that wouldn't give me any kind of laxative effect. But
and how much REMITE are you taking?
REMITE, I'm taking 2 teaspoons, so I'm taking exactly half the dosage in REMITE.
Right, that's right. That's perfect. And calcium, so you're not getting any dairy. Did you go to bone broth or any of those Weston A. Price calcium-rich supplements, food supplements?
I never took calcium supplements, but I was doing a little bit of
bone broth. Have you made bone broth?
I don't make it myself. I know that, like if you go to Whole Foods, you can actually buy chicken bone broth, and you can make a chicken soup out of that. So I've done that. I don't do it every single day. And then I also have this bone broth protein supplement.
Right.
You can mix it through like a little, shake. So I had done that as well. And
what are your calcium blood levels?
And that's the thing that's confusing to me, because when she tested me, and this is at the natural doctor, after I had already gone to the conventional doctor and I didn't agree with what they were saying and they weren't helping, I went to the natural doctor, and the magnesium, the calcium, and the potassium all looked okay. But I know by how I feel, I was at rock bottom. I mean, I literally got to the point where my cells were so deprived of electrolytes that I could barely function. And now
what kind of protein are you taking?
Protein?
Yeah.
So I was doing sometimes shakes in the morning. I would do like a smoothie, sometimes with the protein bone broth. Sometimes you can mix a little chia seeds, or you can mix, there's another one that has
any animal protein. Are you eating any meat or chicken or fish?
Oh, yeah, I do. So I eat mainly meat, vegetables, and then I've added some grains back in. I had for a while taken away the grains, and I realized that caused me some issues. That was during the time when I didn't know that it was magnesium was a problem, but I had taken grains out of my diet because I thought that it was sugar related.
Right.
And by doing that, and I also took the dark chocolate away, and by doing that, I think I really just completely deprived the magnesium. So I've added those back in, and that seems okay. But the calcium, I'm not sure what is the right level of calcium. If you're taking, let's see, like 1,200 milligrams, plus the amount that you eat, plus the amount of dark chocolate, I'm guessing I'm getting about 2,000 milligrams of magnesium a day. And that's
right, yeah. Well, what we'll do, our Recalci is coming out in a month, but in the meantime, if you could email Ginny at support@rnareset.com, we'll send you information about a liquid angstrom calcium so that you can get a calcium that's like our picometer minerals until we can get the Recalcia, because there's that, but I would really also suggest you get our Restructure, because that has really highly absorbable protein, because there's not enough attention paid to, we talk about digestion, how poor it can be, and we circumvent that with our Remite and Remag for, better absorption, but it sounds to me like you don't have enough protein absorption. The Restructure will help that. And the Restructure also has the RNA drops that I think will help with you building back your perfect cells. I think that's the way to go. And, I know it's you haven't been on the whole protocol for even a year yet, but I agree that you should look at the calcium and also at the protein.
Right, and so I've already realized that I've got some serious malabsorption issues, which I was working on. I was taking berberine and grapeseed extract, that type of thing, to try to balance it out. But what I also noticed is that I'm not really breaking down, especially the grains. So I started taking a digestive enzyme. So I ended up with the really bad digestive issues. And in the meantime, I was going to ask you about xylitol, because I've noticed that one of the supplements, it was like a multi-supplement. It seemed really good. It had a lot of herbs and different antioxidants and things in it. And then I realized the other ingredient in it was xylitol. And I was getting a lot of gas and digestive issues. And I thought, and also sometimes this laxative effect, and I thought it was the magnesium. But now I'm realizing that maybe it was the xylitol that was causing those issues, because I removed it, and I don't notice that anymore, and I'm taking the exact same amount of magnesium.
Wow.
So
right.
Is the xylitol a problem?
Well, I mean, it may be for you. They say it's not, but it is a type of alcohol sugar that some people have problems with. It's like anything that can feed yeast, and I guess that's another thing is when you're in such a weakened condition, Candida albicans rears its ugly head, and for that's the Prescript Assist probiotic seems to be the best one.
Okay.
So I'm saying the xylitol may have fed yeast to cause the symptoms.
Right. Well, I'm going to remove that one, or I have, and I'm going to stick with that and try to stay away from that. But my question now is about the calcium. So if I'm getting a total of 2,000 milligrams of magnesium, should I get 1,000 milligrams of calcium, or is 500 enough?
Yeah.
I don't know.
I would get 1,000 milligrams of calcium, and we'll send you that. That's the amount that was in my mind too, and we'll send you the where to get the liquid calcium. Okay.
Okay. And then I have one other quick question, and it was about the anxiety. I don't really have anxiety issues myself, but my daughter has had anxiety issues. And she's very young. She's only 10. But she's had issues since she was very young. And I know that since I've become very ill, I've become extremely light and sound and energy sensitive, and I have ringing ears and those types of things. When she was just an infant, she was very light and sound sensitive. So I think she was actually born with a magnesium deficiency, and she's always complained about pains in her legs. Ever since she was small, that she would complain about having pain. And I thought she was growing, but I really think she was just born with it. And then as she got a little older, she developed anxiety at a very young age. She was only 3, 4, 5, and it continued. And so, my question is mainly for her. I'm having her take Epsom salt baths, and that seems to help a little. And I'm giving her a supplement. It's just 100 milligrams of magnesium, but I don't know how much really to give her. And
how much does she weigh?
How much does she weigh? 65 pounds.
So it's half an adult dose. So if an adult dose is 3 and 4 teaspoons, then she could be taking, 1, 2 teaspoons.
Okay, so if I gave her the Remag, the other question is, how can I get it so that she will drink it? Because I drink it myself and I have a hard time getting it into a consistency that doesn't taste bitter.
I know.
So
is there foods that you could put it in, like applesauce, or, you could just mix it in any foods as long as it's not a really hot food to get it into her.
So you can mix it into a juice or
to anything, a juice, a smoothie. And, spread it out so it's like you're going to start with a 1/4 teaspoon and work up. And you spread it out a 1/4 teaspoon in all her meals, and it should be nicely hidden.
Okay. So I should just start with a small amount and work her way up to 2 teaspoons?
Yeah. Yes.
Okay. Okay. Well, that was basically it for the anxiety question, and
right.
Thank you.
Okay, we know your first name, Linda, so you're going to email Ginny at support@rnareset.com, and then at the end of the show we'll send you an email where to get a good well-absorbed calcium. Okay?
Okay.
And then you'll keep us posted because, it sounds like what our Lynn Foch, who is a runner, she was in the trials for the Olympics, and exactly what you went through happened to her. Exactly. She just felt so depleted, and then she started to get nerve tingling, and then the different symptoms built up. And it's not, you said it all of a sudden you had joint pain. Well, no, you've been building up this magnesium deficiency for decades, and it just finally your body couldn't cope anymore. And, to know that it's the minerals and to really kind of understand is important, but yes, on top of it, then you've got the digestive things, and there is some fine-tuning that you want to do. And yes, calcium is important because yourself. I mean, personally, I don't eat much calcium, but I find if I eat several cups of yogurt over a few days, I get my heart palpitations and leg cramps back because I get too much calcium. So it's, having to adjust, each individual has to adjust. But I agree, once someone gets up to 4 teaspoons of Remag a day, they really have to pay attention to their calcium intake.
Okay. And then also you mentioned to add sea salt. Now, I hadn't been doing that up until now. And my question is, because I add sea salt to my food when I cook, is that enough to do that? Or you're saying it's necessary to add it to the water?
It's necessary to add it to the water. And the reasoning there is we've filtered out all the minerals in our water. Our water is dead. And even, so anyway, our water is dead. Our body depends on getting minerals in our water, and we have to supply them. And rather than using expensive products, because there are trace mineral products that claim to be like sea salt, I just tell people, well, use sea salt and use sea salt if you're doing a 1/4 teaspoon in 3 or 4 liters a day. You're just getting the RDA of sodium, and put it on your food as well. Okay?
Okay. And is it also okay to use coconut water? Because I was mixing the Remag in coconut water because it has a lot of potassium, and I know that I'm using it as well. So is it okay to mix those? Okay.
Yeah, I would consider coconut water to be like a water with a lot of nice minerals in it. So that would be part of your water intake. That's a good point.
Okay. Okay, great.
Okay, great case study here. Great information, great questions. I'm sure everybody appreciates it like I do, and you'll keep in touch with us. Okay, Linda?
All right, definitely.
Okay, great. Okay, and let us know how your daughter does, too. Thanks a lot.
Okay, will do. Thank you so much.
You're welcome. Bye-bye.
Okay, excellent. Yes, very wonderful, generous caller. Perfect. Okay, now let's get caught up on a couple of these quick people who've been chatting and trying to get your attention while you've been on the phone. Let's go back to Paul in Florida, the guy who took too much magnesium. This is what he says. Hi, Ginny. Thanks for getting my message on the air. I'm sorry, I just do not feel comfortable being on that radio. I want Dr. Dean to know that I took magnesium glycinate tablets, 700 milligrams daily for a month. And then I switched to Good State Nanoionic Magnesium yesterday. I took a 1/4 teaspoon at noon and a 1/2 teaspoon before bed. My anxiety went through the roof. If Remag is 15 times more powerful, wouldn't it be worse?
Well, I don't know. Does Good State, gosh, I'll have to look up. Does Good State put the fulvic acid in theirs?
Oh, gosh, I think that's a good, I don't even think Good State is pure magnesium. Let me look. I'll look.
Because there are some of those, some of the magnesium liquids I've noticed, they're putting fulvic acid in it. They say to enhance absorption, but, when you've got, and I don't know the Good State, they're liquid ionic. I can't say that it's picometer or plus 2 milligrams of fulvic acid. When I tried fulvic acid in the past, I refused to use it because it just kind of blew my head off. It just, it's like turbo jets the magnesium into your brain. So I would say it's a fulvic acid reaction, Paul. And Remag, I don't use the fulvic acid. So that could have been the reaction you had.
Yeah, very good point, Carolyn. Yeah.
Yeah. I mean, you could follow up with Ginny on the phone. She understands about this and guide you on how to work with the Remag. But yeah, it's the fulvic acid, I'm sure.
Yeah, very good. Excellent. See what happens when you talk to Dr. Dean. Okay, excellent. Very good. Okay, now let's see. Here's also Melissa wanted to tell the last caller, my daughter had extreme leg pain and even weakness, which resolved when we took her off of nightshades. Something to think of if the minerals don't work. So there's a helpful contribution right there. And let's see what else do we have here. I thought I had one more person. Okay. Kim typed in, it's a question. Okay, let's try this. She types in Prolia, a monoclonal antibody, is used for osteoporosis. My friend is using it for a few years. Her bones have improved, but now they notice tumors in her liver. She doesn't have any other risk factors of health history to predispose her to liver problems. So how can the Prolia have caused this? The side effects say that it lowers immunity. Would you be able to comment on that?
No, I have no idea.
Very good. All right. I thought that was kind of random. But Kim does type in quite a bit, but that's an awkward question, Kim. I don't think Dr. Dean can really talk about that on the air. Okay. Now, Rami wants to know, Carolyn, let's see. How can I help my husband bring his high pulse down? His pulse is 129. He is taking 1 teaspoon 2 times a day of Remag and Remite a half teaspoon twice a day with the pink salt. Thank you.
Well, he's doing. I guess maybe it depends on how much he weighs. Would he need a little more? But that's a high pulse rate. Does he drink enough water? Is he using the sea salt in it? Why is his pulse racing? Is there anxiety? I'd say dehydration might be involved here, and maybe he does need to take more of a therapeutic dose. If he's doing 2 Remag, 1 Remite, men usually, if they still have symptoms, might need to increase to 3 teaspoons of Remag and 2 of Remite, but make sure he's doing his half body weight of water in pounds and ounces of water and the sea salt. Work up to that. I just think it's dehydration for some reason. So let us know about that, Rami.
Okay, very good. All right, with 13 minutes left to go in the show, Carolyn, we've cleared out all of our callers, and now we've got to try to get some mailbag questions answered.
Okay, doke, yes. Here's an AFib question. Person on 200 milligrams of flecainide, and that's the one that has 6 molecules of fluoride, so it's going to really bind up your magnesium, and 80 milligrams of sotalol, which is a beta blocker, which has a lot of side effects. I've been taking Remag for 6 weeks. Had been on large doses of magnesium citrate and malate for 18 months, but RBC magnesium test still only 5. Seen a naturopath, taking many supplements, but now off blood pressure medication. Blood sugar levels have stabilized. AFib episodes. I think there's some improvement. So the question is, the cardiologist, it's interesting because there's improvement. The person's trying all these things, but the cardiologist keeps pushing medications. They want her to take an anticoagulant, which she refuses. Now, taking something for an anticoagulant, what I have in the AFib book is to look at the serrapeptidase and nattokinase, which they use in Japan as an anticoagulant. She said, I've decided to stop the flecainide and sotalol, as one of the side effects can be irregular heartbeat, yes. I've ordered Remite and Realign, so she'd only been on Remag. And so I answered, I can't give medical advice, but what you are doing follows the cases in my AFib book. Reading it will help support your direction. Especially note that it takes time to saturate with magnesium, sometimes up to a year. Read especially CB's case studies showing the gradual progression as you build up your magnesium. And you have to be careful, kind of aware that what I see happening is when patients start to get better and they're really trying to do alternatives, the doctors really up the ante about the drugs. You know, I don't know if they're afraid of losing the patient or they want to prove that they're right or you're wrong, but you do have to withstand their, trying to sort of force you into taking medication. I mean, you can take the medication short term, and as your AFib improves, then you can wean off the medication. I don't tell people to stop their medication ever, but you have to be aware that doctors seem to get more intense about their so-called recommendations the more you try to help yourself. I guess they're jealous. Facebook testimonial. This person just gave a one-liner. The clarity of thought and mind I get when using RNA drops is mind-boggling. I thought that was sweet. And there was a report from a gentleman from India who's been Facebooking about his health for a while. So he says, I've been on Remag since February this year, and from June I started Remite. I have a history of 25 years of ankylosing spondylitis, high blood pressure with blockages in my right coronary artery. I've had an angioplasty 2 years ago. I have muscle aches and pain and joint pains and neck muscle pain, or I should say he had. As of today, I have very stable blood pressure, reduced anxiety, no muscle pain, reduced dependency on non-steroidal anti-inflammatories. My neck pain episodes are gone. I feel fresh throughout the day. My lab test showed improvement in my HDL and LDL. Kidney function test normal, liver function normal. Most important point is my cardiologist who operated on me twice is convinced about magnesium therapy, yay, and admitted that magnesium is very important. He asked me to share all my literature on magnesium and is watching my progress intently. For the past 3 months, I've stopped taking statin drugs. I have advised my pregnant daughter to take Remag, which she is following. My family is taking Remag. My cousin and his wife, a diabetic, have started, and I'm actively advocating the principles of magnesium therapy. So, isn't that awesome? I think that's a yay.
Really, truly awesome. Yes, hold on just a second. We have a big yay. Yes. And Carolyn, I also want to let you know, because we're coming to talk about that Rami did type back and say that her husband weighs 150 pounds and he drinks lots of water with the pink salt.
Oh, that's great. Yeah, so he's a good weight, not needing 4 teaspoons, but the 3 teaspoons I think will be helpful. And just, get him to relax more, Rami, maybe some Epsom salts baths, and lead him to the blog I did called Lying Down Therapy. He might be just pushing himself too much. And, when you start to get a high pulse and it's sort of heart symptoms, it sort of escalates your feeling of, kind of nervousness and worry. Okay, so let's get another letter in here. The Remag and Remite have been really wonderful. We call it our miracle water. My son has a diagnosis of I think it's genetic structural intestinal problem, and has been on osmotic stool softener and select SSRI medication for many years with incomplete results. I was able to stop all his meds, and he's doing perfectly well just on the magnesium and on the Remag and Remite. My wife and I have had great results, too, regarding our neck and shoulder muscles. They are now relaxed instead of hypertense and spasming. We're feeling much more relaxed and we're sleeping deeper. As well, our fatigue and morning fog is getting much better, too. And this is only on 1 teaspoon per day of Remag and a half a teaspoon of Remite. We look forward to upping our dosages to start replenishing our bodies. Isn't that wonderful? Yay. We have so many yays.
Fantastic.
Yeah, I love it when, kids with so-called genetic problems, they improve as well. I mean, the minerals can do so much. Okay, this person says, I realize you do not give medical advice, but based on your products you are selling and the side effects they can cause and the symptoms I'm getting, I would like to get some more precise answers. So I alluded to this, I think, in the beginning where, I said to this person, magnesium is not a medication that causes side effects. It's a crucial nutrient that the body requires. When a person experiences reactions when they take magnesium, it's an expression of how their body's reacting to their particular level of deficiency. Magnesium is necessary for the optimum function of 700 to 800 enzyme systems in the body. So, depending on the duration of magnesium deficiency and the level of magnesium deficiency, when these enzyme systems are woken up, the body can react. So then she goes into, reading all those links can be quite confusing. I'm still not sure with all that info whether I'm taking too little or too much or if it's detox. It seems either way can get these symptoms. Also, my symptoms could supposedly be too little calcium or potassium. This is crazy. I wasn't told that I would have to self-diagnose when I purchased your products. I was told how wonderful I would feel. She said, yesterday I developed a murmur symptom in the left side of my chest. Feels like my heart. It comes and goes every few minutes. I remember getting the same feeling when I was pregnant, and the doctor said I had it because I was pregnant and it would go, and it did. So then about the pregnancy, I said to her, pregnancy is a time when the body burns up more magnesium. So having a murmur at that time indicates magnesium deficiency. Now that you're waking up those magnesium enzyme system, that symptom may become evident. Heart electrical activity is based on electrolytes, magnesium being the most important. And she said she's dropped her half teaspoon of Remag to a quarter and taking it just a quarter of Remite. Any reasons as to why the Remag would cause a heart murmur? It's over 30 years that I was pregnant and had that symptom. So yes, as I just said, it's just revisiting a magnesium deficiency symptom. And then, I just told her, yes, cutting back is the right thing to do. Just go slowly and do some, try to do some more reading so you understand that the symptoms you're having, she says she has muscle twitches all over, but her calf muscles are improving. So it's just someone who, very impatiently wants to be perfect right now. And you do have to work with yourself and your own body and your own levels of magnesium deficiency to really get your health back. This is not a drug where you take it and it suppresses your symptoms. It is going to open up your enzyme systems, and there is going to be a shift. And you can either interpret that shift as getting better or getting worse. And we're trying to tell people that you're getting better. So, the end. We'll give Ginny 2 minutes. Oh, no, I can't even give you that much. Look, a Facebook testimonial. This is from Lisa Winston, who's a health coach who had me on one of her summits. She says, just want to stop by to thank you, Dr. Dean, and her amazing products. She participated in one of my summits. It was a divine appointment. I'd been struggling with palpitations, dizziness, weakness, chest pain, and a troublesome arrhythmia since I was 18 due to mitral valve prolapse and a heart murmur. I have stopped seeing MDs as I'm more holistically inclined and know blah, blah, blah. However, I've been having constant exhausting symptoms, been on Remite for 4 months now. Not only has it gotten me to drink more water, but my heart feels normal for the first time in years. The relief wasn't immediate because I've apparently been magnesium deficient for almost 40 years, but total relief in 4 months, that's pretty miraculous, a real answer to prayer. Love you, Carolyn, and what you're doing for the world without the use of pharmaceuticals. Yay!
Yay! That is so fantastic. Oh, my God. Yes, people don't know that they can actually improve and have a real life, and oh, my God.
And this is a health coach. It's like, the health coach is out there suffering because they don't have their minerals going for them. So amazing.
Right. Thank you, Nancy, for your comments. Paul, just order our website. We can get it in 2 days, too.
Thank you, ladies, for all your comments and insight and information. Well appreciated by the male component in our universe.
Thank you, Bob. Good. Thank you, Ginny. Thank you, Bill. Thank you, everybody, for listening.
See, I got to say something every show.
I know, Bob. You're wonderful.
Say something every show.
But Ruth turned up. That was awesome.
I've only missed one show.
Yes.
Ruth has missed many shows, I think.
AchieveRadio.com.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com.